So I chose Cookeville Regional Medical Center because when I was looking for jobs, my wife, who's from Connecticut originally, I gave her a mandate that I could not move back to Connecticut. And she said Tennessee. So I looked around Tennessee and I talked to a bunch of people in the industry. There was probably 20 jobs at the time. And amongst everyone who I talked to, which is probably 10 or 15 different people who practice and help doctors across the state, they said this was the place to come. They said the quality of care provided here is not degraded by anything, meaning everyone who comes here gets the best treatment regardless of who comes here, whether you're a person on the streets or you're the king of the town. Everyone gets the same treatment because it's the best treatment. And amongst the partners that I was recruited into, that was our standard of care that we used. We offered only what was perfectly correct and appropriate and safe and stable for our patients. And that was really something that, when I came here, we promoted. Number two, the team dynamics of not only the hospital, but the town is unlike any that I've seen in all the places I've been to. From the heart team standpoint, the nurses on the floor, the nurses in the ICU, the nurses and the OR techs and everyone who helps get the procedures done, and the vascular lab, everyone communicates very well and tries to the best of their efforts, smooth out the day so everyone gets done and has the best outcome that they can have. And we're very quick to steer people in the right direction to make sure things are happening as best as they can. So I think there's not a lot of barriers to that teamwork. It's just direct teamwork. And that's a great part about being a team within the hospital. And from the community standpoint, Cookeville is great. Cookeville's community is the first place where I felt like I'm a part of the community, meaning when I go around town, you see the people who you operate on. In fact, I was recently at a dinner and one of my patients, I was at dinner with my partners, and he came and sat down at our table and we had a three-way discussion, and he had a checkup at the restaurant. So he was doing well and he just wanted to say hello. So I thought, this is one of those things that Cookeville's small enough that you can have these close-knit experiences with your patients and you meaningfully contribute to the health and well-being of the community, which provides that camaraderie to the patients and the physicians and the team.